I'm Craig Morrison. Thanks for coming out. We're going to have time for questions, and so I'm going to hit a few of the things that you might ask to preempt some of the more common questions and maybe stir some other questions. Some of the myths and misconceptions we hear in the office many times about joint replacement. So, one of the most common questions, am I too young or am I too old? And the real answer about age is that it is just a number. And there is not too old in terms of numbers. And with older patients, mostly what we worry about is whether or not they have significant health problems. And if we look at studies in 80-year-old patients, we know that if they have similar health problems to patients much younger, that their outcomes, at least in total hip replacements, are exactly the same as their younger cohorts. So you are never too old for joint replacement surgery. And on the flip side, you're not necessarily ever too young. With young patients, we worry less about the medical problems with their surgery and more about the longevity of their implant, whether they might wear it out. I heard about a joint replacement that lasts forever. And we do hear these questions. And in fact, there was an article recently, a surgeon in India telling his patients that there's a new procedure that will last 100 years. That's not true. It may, but he certainly doesn't know that. So, as Dr. Christie mentioned, new and improved in joint replacement, they don't necessarily go together. We do not know if something is improved until it is no longer new, okay? So our job, hopefully our expertise and our experience, helps us decide which things are new that may actually be improved. And with the discussion with our patients, we try to decide whether or not something new is worth trying. So, will my implant last forever? Well, no. If you live long enough and wear it out, it will not last forever. The limiting factor in knee replacements is what we call the polyethylene insert, or the plastic, which you see on the right. And you see the one below that, that is a worn out piece of plastic over years and years of good use, hopefully. So the plastic part can wear out, and we recommend that you avoid high impact activities, especially after knee replacement. That being said, there are good results that show high survivorship at 15 to 20 years. And to put that in perspective, 85 to 95%. We take 100 patients, 15 to 20 years later, 85 to 95 of them still have their joint replacement and doing well. And there's been a study that shows that is true even in patients under the age of 55. So you're not necessarily ever too young to have a replacement. Now with hip replacements, you're going to hear a little bit about alternative bearing surfaces, and we certainly will have questions about that. But depending on what we put in, and it's not just always plastic, activity restrictions may not exist, and you may not necessarily wear out your replacement as quickly. And we certainly encourage patients to go back to low impact activity. Bicycling, bending over is not an issue, so some of the restrictions you hear about before don't necessarily apply. So along those lines, what can't I do after surgery? Well, again, a little bit different between hips and knees depending on the surface that's rubbing together. But with some hip replacement parts, there are no restrictions. With knees, we generally recommend avoiding repetitive high-impact activities that involve a lot of running or jumping, but otherwise there are no restrictions. What can I do after surgery? Unlimited low-impact activity. So we want you to work out. We encourage that. Walking, biking, swimming, elliptical trainers, golfing, hiking, horseback riding and motorcycles, that's not a problem. We get those questions all the time. And even going to the gym, we just encourage you to use less weight with higher repetitions rather than trying to max out. But again, the repetitive jogging and jumping, the high impact activities like basketball, singles, tennis, we discourage. You may be able to do it, but we don't necessarily recommend it. So, do I have to do exercise for the rest of my life with physical therapy? Well, yes and no. The implant is like the body of the car, but you have to keep the engine in shape. okay? Going to the gym's like keeping it tuned up. And although the therapy is very intensive right after surgery, it doesn't have to stay that intensive. But we do notice that patients that get to that 3-month mark and say, I'm over it, I'm recovered, and then they stop doing their exercises, they tend to come back with a tendonitis here or an ache and a pain here. But the ones that lifelong continue some low-level exercise repetitively, they tend to feel better year after year. So there's a long time for improvement with the joint replacement. And we talk about the non-surgical things. Is there a cure for arthritis other than surgery? Well, really, even surgery is not a cure for arthritis, because as you've heard, it's a problem with cartilage. And then once the cartilage is gone, it does not come back. There are treatments that help decrease the pain, but nutritional supplements such as glucosamine and chondroitin sulfate do not grow cartilage. They don't change the joint space. Injections like cortisone or Synvisc or Hyalgan, they decrease pain and may be a good way to manage arthritis until somebody's ready for surgery, but they don't cure arthritis. And something like prolotherapy, which is injecting a mixture of caustic agents into a joint to incite an inflammatory response, also does not have very good published data on affecting the natural history of arthritis. So unfortunately, there is no cure. So when's it time for joint replacement? Well, it's a quality of life decision. You'll hear that over and over again. Nobody needs to have a joint replacement, but it does not get better by itself. And so at some point, people choose to have a replacement. And if you're well informed, then you can make that decision yourself. So you decide when the time's right. So, a little bit about this part. I heard about a surgery that's pain-free and outpatient. Dr. Hodrick is going to talk next about pain control, and it's true we've made a lot of advances in this arena, but it is not pain-free. Those are joint replacements on the right. They're invasive, so it does hurt. So no pain-free. And although we are moving towards shorter hospital stays, there are things that we want to accomplish before you leave the hospital. Your pain has to be controlled. Medically, you have to be safe. And with therapy, you have to be safe, stable, and independent to go home. And that usually takes more than a few hours in the recovery room. One small thing about minimally invasive surgery, again, Dr. Christie mentioned this, but again, not all new ideas are necessarily advancements. And in hip and knee replacement surgery, we're seeing articles pop up all the time that not only show a higher rate of complication, but not necessarily an improvement in the early function. So a lot of it has to do with the pain control and the therapy, not necessarily the size of the incision. It's like putting a ship in a bottle. And when we're doing replacements, we don't have the luxury of a transparent skin. So we need to be able to see to put the parts in well, and that's what gives a good outcome. Thank you very much.